Herrick, who is the project manager for MaineHealth's Alzheimer's Disease Partnership Grant, Mark Bowtwell, who is the Director of Social Services at Senior Solutions, and Ellen Thompson, who is the Lyme Parish Community Nurse. So I'm going to turn things over to Katlyn. Or Tamara.
Or to me. Can you hear me?
Yeah. Yes,
okay.
We can.
I'm not on my phone. Okay. Hi. As Jess said, I am the program manager for the MaineHealth Alzheimer's Partnership, as the slide says. Next slide, please. So I'm going to be talking about an evidence-based program that we're implementing in Maine. Oh my goodness, it's snowing here. And it's called REACH Community. REACH stands for Resources for Enhancing Alzheimer's Caregiver Health. And as I said, it's an evidence-based program that has been shown to reduce caregiver burden and improve health outcomes. We're targeting people that are caring for individuals with dementia, and that's kind of a broad criteria. Anything that falls under the umbrella of dementia. They don't even though it's the Alzheimer's Partnership, they don't have to have a diagnosis of dementia, Alzheimer's disease. The length of each session is 1 hour. It's different than traditional therapy. We're working with our behavioral health clinicians that are integrated in primary care practices. So their typical session is about 45 minutes, so this is a little bit longer. The length of treatment varies by participant based on what the needs are and how long it takes them to get through the programming. So it's ranging between 2 and 4 months right now. The participants can access up to 5 sessions, but the dose effect is 4, so they have to participate in at least 4 in order to be considered completing the program. A great piece of this intervention is that it can be done in person or by phone. So for distance caregivers, that can be a real issue, or just caregivers an issue in general who are burdened, to reduce that needing to go to another location and have another meeting outside of the home. And then we are doing some evaluation to look at caregiver burden at baseline and then after the intervention. Next slide, please. As I said, we are working with Maine Behavioral Health Integrated Clinicians. So these are social workers that are embedded in primary care practices across our service area. This project is focused in Lincoln County and Greater Portland. And so this slide shows you a little bit of the distribution of where these clinicians are located. Since I created this slide, we brought certified an additional 3 clinicians. So we're up to 17 locations in this service area that's on this slide. Next slide, please. So this slide shows what the criteria is. So they have to be a caregiver of a person living with cognitive impairment of some sort, and the patient has to live in these 2 geographic areas. The process involves either a warm handoff in the clinic or the practice. So say the way it would work is either the patient is in the practice meeting with the care team and a caregiver is with them. They could be identified that way. They could be identified, the caregiver themselves could be identified as an existing Maine behavioral health patient who during the course of that work is identified as also being a caregiver. And then finally, the patient with dementia's provider could refer the caregiver to one of the clinicians. They can also, one of the things that is working really well for us is that they can, the providers can refer directly in the electronic health record to the BHI clinician. And then there's feedback about what the outcomes are for those participants, and either they can look at the health record or they can talk directly to the clinician. And so far, we have gotten worked with 32 people in these 2 caregivers across these 2 service areas. This is our 3rd year of the project. So as I said, we just certified 3 more clinicians, so we just anticipated just continuing to snowball. The health system is really liking this intervention, and so what we're working mainly on now is how to sustain it going forward after grant funding. And that is all I have to say for today. Katlyn's next.
Outstanding, thank you.
And next slide. I'm going to talk about music and memory. So basically, music and memory is an intervention that uses personalized music playlists for people living with dementia to manage emotional and physical stress and reconnect with the world. A lot of studies have linked positive outcomes in behavior management for people living with dementia. And I'll have a website at the end that lists several of these studies on the last slide. Music and memory is different from music therapy in that it's tailored to a person's preferences, and it's portable, it can move across care settings, and it can be shared. There are currently about 4,800, maybe a little more than that, settings across the United States where music and memory is used, whether it's an adult day setting or an assisted living facility or a nursing facility. And just locally in Maine, we have 51 sites where it's being used. New Hampshire has 76 sites, and Vermont has 19. It's also been adopted worldwide, so the number is actually much larger than that. Next slide. I just want to talk a little bit about some of the barriers to integration into adult day centers and other secure settings for people with dementia. In the adult day services setting in particular, some people living with dementia have an easier time with integration than others, obviously. Others may feel very comfortable in a new setting and have and then while some are very uncomfortable, they may have a really hard time joining in and finding comfort in the group setting. The fear of the unknown can cause so much resistance, and sometimes that's a deciding factor on whether a person living with dementia can successfully integrate into a new care setting. Exit-seeking behavior is, it's seen in people who are looking for ways to leave the setting. They often ask staff to help them find their coat. They believe it's time to leave and that their care partner is waiting for them outside. They sometimes station themselves by doors and attempt to follow staff out as soon as the door is open. We've experienced that. Some people living with dementia will insist on spending the entire day in a state of readiness to leave. In other words, they want their coat on and their mittens on and their hat on and all the things that they came with nearby so they can make a quick exit as soon as possible. If someone's experiencing pain or discomfort, they're much more likely to want to be home or in a familiar place and not likely to want to go to any kind of setting. And while sundowning is not experienced by every person living with dementia, it is a concern for some as it manifests in the late afternoon as the sun begins to fade, and some of the symptoms are agitation, pacing, labored breathing, and sometimes aggression. Next slide. So how can music and memory help? Studies have shown a reduction in the use of medications, first of all, to address behaviors, which is fantastic. People experiencing the effects of sundowning often benefit from the option of music and memory as a diversion toward calmness and regrouping. Music and memory intervention has proven effective in temporary pain reduction. It's also effective in fostering social engagement, and there's less resistance to receiving care, such as toileting, receiving medications, and even eating. And of course, as you can imagine, all of those benefits are not only for the person living with dementia, but also for the staff who work every day to provide a safe and welcoming environment for people they care for. It can also be beneficial for care partners to be part of the process in compiling the playlist, as well as having another tool to use at home. Next slide. And some additional benefits. The social work staff and the recreational therapy staff necessarily have to spend more time, or a little extra time at least, with each person, so they get to know them a little better, and the person with dementia gets to know their staff a little better as they go through this process of compiling a playlist. If the person with dementia doesn't like having anything placed over their ears, and they often don't, then a small Bluetooth speaker can be used instead with the same effect. Those are all inexpensive and easy to find. As I mentioned earlier, music in memory is portable and it can be used across care settings, and care partners can participate as little or as much as they like. Some care partners use the time as a kind of a mini respite, while others join in and listen as well. It's all individual. We've seen it used both ways. Another benefit in the day services setting is that it's often people listening to their playlist. Sometimes they want to share their music with others, and that further enhances socialization and connection. And more often than not, we've seen a private playlist be shared and turn into a dance party at the day centers. It's really a very amazing intervention. Next slide. As far as the sustainability goes, we're part of the grant, MaineHealth, that got an ADI grant from ACL, and so we've been wondering whether we could sustain this. It's because it has been so successful at the day center, and I'm happy to say that this is very possible. The actual costs for this range anywhere from $500 if you have a setting of 8 members or less, to $1,200 if you have multiple settings or more than 50 people. And there's a $200 annual renewal fee, very doable. The equipment that's required includes headphones, personal speakers, and then, excuse me, we use a monthly charge to Spotify so that we can have access to lots of different types of music. And that's about $15, I think. The other thing you have to take in mind is the staff time to interview and learn the music preferences and put the playlist together. And we use student interns and volunteers sometimes to do that, which is really, really helpful. And then to wrap up, here's the link I talked about for further information, as well as the academic studies that have been published to date. I found this website to be really helpful. It's current, and there's a lot of support from the people who run this if you have questions or concerns or want to learn more. And that's it.
Good morning, this is Mark. I'm just going to run through really an overview of the programs throughout Vermont that we use. Next slide, please. So Senior Solutions is one of the 5 area agencies on aging in Vermont. We all provide a wide variety of services, and most of those services benefit people suffering from dementia and their caregivers. Each of the agencies has a designated caregiver service coordinator. Those folks reach out to caregivers, provide support, and implement a lot of the grants and services that you see listed below. One of the things that I realized I didn't put on this slide is that each of the agencies also has a senior helpline, which is a 800 number that anyone can call for support, well, for services, and connects people to services. So caregivers use that quite a bit. And also, as with many agencies, I'm sure, around the 3 states, our case managers provide case management for a lot of clients on choices for care or choices for independence, or I'm not sure what it's called in Maine, but you know, that's a Medicaid program that supports people aging at home. And certainly we have a lot of clients with dementia who are at home, who are receiving services at home that we provide case management for. We have active, powerful tools for caregivers groups around the state. That's an educational program. If you're not familiar with it, it's really terrific. It really works specifically with caregivers for giving them tools to take care of themselves. A variety of memory cafes around the area and various support groups. The other piece that I didn't put in here is that each of the agencies works with the local mental health agency to provide therapy services through our elder care program. And those services are counseling services that reach out to people who are homebound, including people who have some level of dementia. And Cinda Daunton who I think may be on the call, is the elder care clinician from Rutland. She works for Rutland Mental Health, but works with the Southwestern Vermont Council on Aging. We certainly connect people with a lot of respite grants and educate caregivers about supports and services. I'm always working with caregivers to provide grants for respite so that they can get away or have someone come in and assist them. We provide options counseling to help people plan for the future, thinking about, you know, what it takes to keep someone at home, or at what point do they need to seek other supports and, you know, other options. Our agency, Senior Solutions, has a variety of wellness programs, including Tai Chi, water aerobics or aquatics exercising programs. And we have a robust senior companion program that reaches out and provides companionship to seniors and friendly visitors. And we recently started a vet-to-vet program, working with veterans who are volunteering to provide support and companionship to other veterans in the area. And I think the thing that's on the bottom that I can't see says community education. So we certainly just provide a lot of education to other agencies in the communities and around caregiver supports and things like that. Next slide, please. So just specifically, Cinda sent this to me. She is in Southwestern Vermont. They have a Caregiver Coalition that provides an annual conference. Lots of folks benefit from that. And she also leads a program that provides direct support to caregivers to help them with their stress and problem solving, and really a variety of ways to support them in their daily work and providing support. And again, having a monthly support group. Next slide, please. In Vermont, the Center for Aging at the University of Vermont provides support in a variety of ways. They have an annual gerontology symposium, which often has a lot of breakout sessions for caregivers, and just a variety of informational sessions around aging and normal aging and not normal aging, things like that. We have the UVM Center has a strong connection with the Alzheimer's Association, and they support the Family Caregiver Alliance. And obviously they also support the Tri-State Learning Collaborative. And I think the next person is going to talk about the Dartmouth Aging Resource Center, but since Senior Solutions is in southeastern Vermont, and a lot of our services are in the Upper Valley, which is around White River Junction and Lebanon, New Hampshire. We certainly utilize the Dartmouth Aging Resource Center as part of the Dartmouth Medical School to a significant degree. And they provide a lot of support groups and education programs and just a lot of other programs. Next slide, please. Each of the agencies on aging are part of a larger Vermont Association of Agencies on Aging, which provides a variety of supports. But one of the things that really is been a great support and resource is that they have an annual conference. And last year it was on exploring solutions to social isolation. Say that 5 times fast. And again, lots of resources for caregivers. This coming fall, the theme of the conference will be Framing Aging in Vermont. Next slide, please. And again, as I mentioned, there's a strong chapter of the Alzheimer's Association in Vermont, which we all utilize, and we regularly refer caregivers to for their support groups and their 24-hour hotline. And last slide, please. Next slide, please. There we go. So across Vermont, there are 17 adult day centers, which we utilize significantly. All the agencies on aging have strong relationships with these adult day centers. I provide grants to individuals to participate, and again, they serve many people with dementia or Alzheimer's, and they provide a variety of programming that stimulates attendees in various ways to promote brain and physical health, as well as social connection. And it provides really important respite for caregivers. And there's also a wide variety of senior centers throughout the state that provide less structured programming, but things like exercise, congregate meals, art classes, etc. And I think that's all I have. Thank you very much.
Ellen?
Hello?
We're looking for Ellen. Are you on mute, Ellen? If you are, you hit *6 to be unmuted.
Can you hear me now?
Yes, we can.
Okay. Could I have the next slide, please? So I'm going to talk a little bit about New Hampshire resources for Alzheimer's patients and their caregivers. Next slide. So ServiceLink is the statewide resource for aging and disability resources in the state of New Hampshire. They've got 13 offices throughout the state and cover every county. And basically it's like a one-stop shop for education, support, and shared resources for residents. So you can use those resources with specialized people at ServiceLink for Medicaid, for applying to Medicaid, for finding a caregiver, finding a program to assist you in caring for a loved one, seeing if you qualify for assistance in respite care, etc. It's a great resource, and underneath it are a number of other programming things. Next slide. One of them is New Hampshire Care Path, which connects people to aging, disability, and independent living resources within their community. And those services and supports you can see listed below. Many things are very difficult to find access to. Adult day services are not quite as plentiful as it sounds like they might be in Vermont, but there are some around, and it really takes understanding what those resources are in order to find something for your loved one that really will work for you. They provide some assistance in home care, information regarding Medicare and Medicaid services and what they will cover. It includes adult protective services, long-term care, nursing home and community-based care resources, Meals on Wheels, and transportation. All extremely important as you're trying to navigate caring for someone with dementia. Next slide. Choices for Independence program is available for seniors and adults with chronic illnesses who are qualifying for Medicaid and medically qualify for a level of care provided in a nursing home. It is a program designed to keep people home rather than moving into a nursing home. And it provides a wide range of service choices that enable adults to stay in their homes and in their communities. You have to meet financial and clinical eligibility requirements in order to qualify, but it can be a really great resource for someone with limited means. Next slide. It also provides in-home services to help with activities of daily living. So even if you have and you must have a caregiver in the home, so that can help the caregiver tremendously with just activities of daily living, like getting someone cleaned up, helping with general household tasks, and meal prep. It also provides some medical equipment and supplies and adult medical daycare services where they're available, and respite care. The options counselor at ServiceLinks can help people to explore their eligibility and the alternatives that they may qualify for. Next slide. The Centers for Health and Aging at Dartmouth Hitchcock that Mark mentioned include a lot of services around the education and support of people dealing with Alzheimer's disease and other dementias. And they focus on improving the physical, mental, emotional, and spiritual health of older adults and their caregivers by providing education and support. They have a close alliance with the Alzheimer's Association. They do provide dementia education and caregiving education, support groups for folks with dementia and their caregivers. Next slide. Some of those educational programming include legal planning and the dementia journey in collaboration with, I think, Dartmouth Psychiatry. They have also provided healthcare agent information, how to be a healthcare agent for someone living with dementia, and also as a planning guide for folks completing a advanced directive, the various stages of dementia and what your wishes might be as you progress through the disease. They include the educational opportunities also include effective communication strategies, what is normal versus not normal aging and memory, savvy caregiver class, and understanding and responding to dementia-related behavior. Some of these programs are available on video, and I know a lot of people have accessed that because it is so hard sometimes to get out of the home. Next slide, please. The Dementia Engagement Program includes a memory cafe that's happening monthly, and new perspectives of looking at art with people with dementia. Next slide. Support groups are also available for caregivers of people with dementia and how to care for yourself while caring for another. Next slide. An additional resource is the position that I took after I retired from Dartmouth as a nurse and a care manager, and that is as a parish nurse. Located now in the Upper Valley, Manchester area, and Exeter, they serve local parishes and or communities. In my case, I serve both the Congregational Church in town as well as the entire community of Lyme. Many are now being hired by communities, or groups are forming small nonprofits in order to pay for and support a nurse in their community. So they're independent of both the church and the town. There's no fee for services from the client, but they are valuable in filling the gaps in our current healthcare system by providing support, some care coordination, resource assistance, helping identify and rally community resources and volunteer efforts within the community, sometimes initiating aging in place groups and organizing volunteers and people who would like to visit volunteer visiting programs. Next slide. Thank you very much.
Excellent. Thank you all very much for your presentations. And we do have just a few minutes for questions and answers, so would love to know if anyone has a question for any of our presenters.
Hi.
And of course, go ahead.
Sorry, this is Ashley. I'm part of the Conway group. I was interested in a little bit more about the Maine Behavioral Health Program because I think I missed the beginning of that. I was having some trouble connecting. So it said Greater Portland and Lincoln County. Is that something that would be eventually spread to other MaineHealth facilities, like possibly the one over in North Conway?
Hi. Yes, I forgot that to mention that we also have a clinician trained at the Mount Washington Valley Adult Day Center. She's not certified yet, but that is one way that, so we have expanded it to North Conway. They're under contract with us to do some other work, but.
Yeah, Ashley, oops, sorry. Tammy just finished the course, is actually finishing it today, so yes, she will be certified.
That's wonderful to hear. Thank you.
You're welcome.